Welcome back to HERcast with Dr. Chito, where we continue our important conversation in Fearless and Fit Women Cancer Prevention series. In part one, we focused on breast cancer prevention with our esteemed guest, Dr. Zainab Shinkafi Bagudu. Today, in part two, we shift our focus to cervical cancer prevention and the crucial role of HPV testing, human papilloma virus testing. Now, cervical cancer is the most preventable form of cancer, yet it remains a significant health challenge, particularly in regions with limited access to screening and preventive health care. A few years or many years back, we did a research here in Nigeria where we looked and we tested for the incidence of cervical cancer in Nigeria. What we saw was the incidence of cervical cancer in Nigeria was similar to the one we had in the US. But there was a significant difference in the incidence of cervical cancer. It was much higher in Nigeria than it was not only in the US, but other countries. And the reason for that gap was seen as the lack of cervical cancer screening. The stark difference in cervical cancer rates highlights the significant gap in cervical cancer screening. It underscores the importance of accessible and affordable preventive healthcare services for women worldwide. So we are honored again to have Dr. Bagudu with us once again to discuss how can we close this gap, improve access to preventive care, and save countless lives. Her expertise and dedication to women's health continue to inspire and inform our journey toward a cancer-free future. So let's dive in and have this crucial conversation.
Welcome to the second part of our conversation on cervical cancer.
Just to start and give you a background, I just want to say a little bit of how cervical cancer most times occurs. There is a virus called the human papilloma virus, HPV. And there are different types of human papilloma virus. One, the low risk, and then what low risk causes what we call genital warts, and the high risk viruses that are the ones that can lead to cervical cancer. These viruses go into those cells of the cervix. Cervix, again, is the entrance of your womb, the little tunnel before your womb. And around there, it will infect those cells. And in most cases, like any other virus, your body could fight and clear it. But 20% of people will not clear it. And as it stays in the cells, it changes the cell, and you can gradually progress to a pre-cancer state and then a cancer state. It can take up to 7 years for this whole process to occur. So that's why it's preventable, because if you screen, we can catch it early and treat it. So it doesn't get to the pre-cancer stage and to the cancer stage. So therefore, you don't get cervical cancer. And HPV is responsible for at least about above 95% of cervical cancers that occur. So this is why this conversation is really important. The importance of screening, the importance of HPV testing, and the importance of the HPV vaccine. So now I'm throwing it to Dr. Bagudu as we continue this conversation.
Thank you, Doctor.
What has been your experience with assessing pap smears and HPV testing as cervical cancer screening tools in Nigeria?
I would say that my experience is getting better. Initially, when I started in the cancer space, it wasn't as accessible. The tools were not as available in Nigeria. When you talk of the vaccine, the screening, and the early treatment, these are the three pillars that we can use, as you have pointed out, to eliminate cervical cancer, because it is the one cancer that can be eliminated by using these three simple pillars. If we can catch 90% of the world's eligible population and screen them, but that is women over the age of 35, and screen them. So the aim of the cervical cancer elimination agenda is to vaccinate 90% of the eligible population, that is girls aged between 9 to 14 years, screen women from the age of 35, and sexually active women from the ages of 35 years, screen them with a high performance HPV test, and treat those lesions early. The treatment tools are really quite simple and can be done in an outpatient clinic, or sometimes, like we that work in the field, we do them in field outreaches. So initially, all these three pillars that I mentioned were, should I say, very scarcely available. The vaccine was only available for obtaining out of pocket in private health facilities. There have been one or two pilot studies where it's provided free, but it's not the norm. Today, we have had successful rollouts. It's on the National Primary Healthcare Development Agency immunization schedule. And we have had two successful rollouts, which covered all the 36 states of Nigeria plus the FCT. And the number of girls that have been vaccinated as at today is about 13 million Nigerian girls aged between 9 to 14. The more difficult one is the screening. However, with the COVID pandemic, we were able to grow the capacity of diagnosis for molecular testing generally. If you remember, when the COVID pandemic started, there was a lot of outcry, and there were these maps that used to come out of the Center for Disease Control, where you would have one dot, this state now has a molecular testing facility, that state has, and slowly it filled up the whole country, and every state had one or more testing facilities. Those same machines are used for HPV molecular testing. So we now have those facilities.
Which is amazing.
That is absolutely amazing. Now the question remains, how are we using them? Are we accessing them to test for HPV and detect cervical cancer earlier? There is no national screening system and there are policies. That's wrong, I beg your pardon. There is a policy, but it is not being implemented.
And I always say a policy is only a paper
as
if it's not implemented. Implementation is key, and of course we talked about sustainability.
Absolutely.
As well. Right. So I'm going to integrate. I'm the medical part, so before the public health, but what age should I start getting pap smears? And I'm going to answer that and say by the age of 21. But again, in Nigeria, as you said, is kind of different because of being accessible to these things. And you said 35 for the agenda. And that's important to note, because I just want to make sure that when you Google, you say, oh, they said 21. Where she's talking about here also is what we have available in developing countries and how to assess pap smear screening. And
actually, the teaching is sexually active.
Yeah, sexually active or age of 21.
Active, yes.
Now I'm going to ask you about. You talked about what we're hoping to achieve. What are the actual specific challenges? Say in places where you now want to go ahead and do this outreach, because we want to do outreach, and half of the population or even 1/4 just come out, because unfortunately. Having a pap smear, it may not be the most comfortable exam. So how do you succeed in doing these cervical cancer screenings in these areas? And I know you said something about self-sampling. Is that easier?
Of course, it's not the most comfortable test for a woman to have. Women, although we give birth, we're not very comfortable with going and sticking your legs up. And I read a study once that even in high-income countries, Western countries, you're more comfortable with a female gynecologist like Dr. Chito. and instead of, so these are women who ordinarily do not access hospital care, and we're now asking them to just come for a routine test. So it takes a lot of convincing, a lot of pre-ground efforts and covering the communities. And this is where advocacy comes into play. You have to work with community gatekeepers. It could be one woman within the circle that is able to, that they listen to, or they admire, or they envy, that will come for that test. I had a funny story in Cote d'Ivoire the other day about this very influential man that was told that it's given to girls, the vaccine. And he asked why. And he was told it's not available. The vaccine is not available. It's given to only girls. But men take it in, boys also get it in advanced countries where it's available and it's very expensive. That's why we don't have it. So he took all his sons and gave them HPV vaccine just so he could say that he had enough resources. So that kind of mentality, we have to play on it in different ways. Community gatekeepers, religious leaders, traditional rulers, the football coaches in the village. We need to employ all their influence and work within that area of influence to convince them. And outreach is only as good as the people that turn up, the number of people that turn up. So how do you make it known that you're having that outreach beforehand? The usual medium, social media, radio is very effective in our communities, and then also word of mouth by these gatekeepers. If the king or the ruler calls them and tells them, or sends his disciples and they tell them there's going to be this blah 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 coming for an outreach on so day, they tend to come out. Now, I want to mention at this point another factor that we don't often consider when we're looking at health issues in low middle income countries, and that is incentive. It does not cover just the people, the community, the women. In this case, we're talking about cervical cancer screening. And I'm talking about what can you do to incentivize them and make them come out for that screening. I am also going back to the healthcare workers. Very important factor, and one of the reasons why we're having a lot of professional flights to high income countries. You have people that are overworked, their institutions are understaffed, they're underpaid. And then we come with our programs. They're supposed to be taking deliveries. And I go to the maternity unit and tell the nurse that I want you to start doing pap smears and HPV. Take the sample, give them the kit, and ask them to do the sample and, supervise it. As when I was First Lady of Kebbi State, we got grants from WHO. The states gave counterpart funding, and we were able to set up a screening system. And that's exactly what I did. I went to the healthcare system, the professional, the workers, healthcare workers, and told them we had a WhatsApp group. You have to do these tests. Let's do this test. Let's screen. The program budget did not cover an incentive for them. And immediately there were rumbles behind the scene. So why are we going to do it? They have the money. We're not paid to do that. It's not part of technically it's wrong, but this is what they are facing. And that is the reality of our lives. That's the reality of being a health professional or administrator in Nigeria and other low middle income countries. So as a First Lady, I'm able to go for those outreaches. This might sound crude, but it's the fact. I'm able to go for the outreach with a bar of soap, with some food wraps, and we offer to the women, and they come in thousands. So the gatekeepers do their work. You use the incentives that you have available. We are carrying out a polio immunization program now. It's still ongoing. It's funded by Bill and Melinda Gates, Bill Gates Foundation. Or is it Gates Foundation? I don't know. Gates Foundation now. And it's quite successful in security challenged areas. But we're now on the 6th round. And the people started asking what's there for them. All the time you bring your vaccinations and we take them, but you're not coming with anything. So this was discussed, and what was decided was that we would take the nutritional supplements, Tom Brown, for the children that are malnourished in the area. And it's working. So it doesn't have to be...
You have to be able to think of
you
other
have to
ways.
think out of the box. If we're going to offer those healthcare workers, if I go back to them, some extra skill set, some form of insurance to cover their children, or free education, or even something that the government has access to, or the organization that is doing this program has access to, then it's a win-win for everybody. But when we design these
And you're doing
programs,
this to promote their health.
yes, but
Because
this
I
is,
know, I understand that, but I just
yes,
want to make sure that they
yes,
understand that the
yes.
whole
So,
concept is
so
improve
that
the health
they
system.
understand,
Yes.
and then you let people feel, and we have to face that fact, we
It's
just
in
have to
decline.
face it. Yes.
Yes. I mean, we that do outreach, we know that if we go without food, it's as if we didn't
I
come
mean,
to do
we're
anything.
not talking, we will talk about, we didn't talk about it, but it's a fact.
But it's a fact.
You need to take something. It could be food, it could be, cosmetics, something to add value. I saw a program in Rwanda where it's a much smaller population. They're doing fantastically well in the screening and treating. And you know what they give them? One egg. One egg to each woman that comes, and it makes the difference.
And I think it's very important for people to recognize that, you see, when we're talking about this and they wonder, okay, maybe they don't want to come out, and why bother? It's very important to understand that improving their health system, improving their health, improves national health, improves global health. So what we're trying to do in this circumstance is make sure we have healthy communities. And that has so let them look at the big picture of why we make sure that you do what you do to bring people out. Because I also know how we think as well, like, but it's their health. But no, that's not the case. Saving lives is what we're trying to do, right? So you're trying to save lives, and you have to do all you can do to make sure you get to your end goal.
Absolutely.
And I think it's important that they know that.
Let's do sustainability now.
So now we have all these programs. All right, we have all the programs, what we do. We have some programs coming from development partners and all that. But how are these programs sustained? Because it's one thing to start something, but I think that one of the biggest important thing is to sustain that so that it continues even beyond us. It's something that just continues. So what do you think about the best way? And I had to come again because in all your capacities, I think that's something that lays very heavy on your mind. How do we sustain these programs?
You're very correct. And we've had these conversations with you. So you know that it's an issue that I have in terms of sustainability. It is very difficult. And it comes from the mindset. It can be done, but at the moment, the mindset and the political climate that we have in Nigeria, as we do in a lot of other LMICs and developing economies, fragile economies, political instability, is the sustainability thoughts are low. Every government comes in with an idea to start a new program, or even if they're going to continue the same programs, they do not continue from where it is left off. Very few do so. So we need to work on our political leadership right from the grassroots to be able to sustain more. And also the programs can be funded in a way that I don't want to use the word enforces more sustainability, but there has to be some more guidance to the funding that is being given. I mentioned we had some funding support from partners. And so the next round, they shouldn't give that. If it comes up again, they shouldn't give that support. And if the government is not willing to put their own part in it, or they look at the numbers, the monitoring and evaluation part, and it's not as it's supposed to be, then back off your funding and go to somewhere else. But we should make it known why they're pulling out of the state or that state, or so that the governors, the leaders of the states can understand that it's not just about pooling resources to my state, but what do you have to show for it? Even the federal funds, there needs to be more accountability.
All right, I think that's very, very important. Now, I want to move to treatment of cervical cancer. And I know you talked about breast cancer. And before that, I think we were talking about one of the things that we actually didn't talk about earlier was how important family history was
in breast
cancer. And so that's why when we're talking here and we're talking about different things, do try and follow through. But as we said, family history is very, 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 very key. And that's why I will keep on saying visiting a doctor at least once a year, or just for those that may not have access, but at least understanding your family history is so important when it comes to any type of cancer, especially breast cancer. Knowing who has had it and what age did they have it in your family is very important information that we use to guide you properly in both breast and cervical to proper screening, to a proper screening system. So it's very important that you check this up with your doctors yearly. Now I'm going to move to cervical cancer treatment as well. Before I do that, I'll let you guys know that cervical cancer, one of the early signs we always say is, I always tell you, is bleeding. When you have like bleeding, I want to use bleeding, and I use it cautiously because we have problems with bleeding throughout our ages as women. But this is, most times after sex, we see bleeding. We try to make sure we rule out any signs of cervical cancer, and that's just for your information. Now, whenever I see a patient, right, and I see that the patient has a lesion on the cervix, and we biopsy and it's cancer, it breaks my heart. And the one thing you always hear is, I've never ever had a pap smear in my life. And I think that's one of the driving forces of, I guess, what you do as well, because it really breaks my heart when I know that, we could have prevented this. We didn't need to get to this point where we're now dealing with cancer. Now, how accessible, and I'm sure maybe it's the same issue, is treatment for cervical cancer in Nigeria?
It is the same issue. It's not as accessible as it should be to save the lives. There are a lot of devices in circulation now that offer cryotherapy, which can treat the early stages. But for the more advanced ones that need radiotherapy, surgery is sort of available and much easier to achieve in terms of costs, more affordable. But the radiotherapy is not as available as we would like it to be. There are centers, I think we have about 7, but right now I'm not sure that we have up to 4 working. We've seen some private centers crop up that are offering radiotherapy. There are plans by the federal government to include 6 more diagnostic and treatment centers for cancers, because like I said, cancer is the fastest growing non-communicable disease that we have today in the world, actually, not just Nigeria. So that fact has made the government dedicate funding towards building more centers. How soon that's going to be, but at least we're doing something to make it better. And the next issue is the funding. How do the patients afford it? Recently, again, there was another move to cover cancer care under the National Health Insurance and include more of Nigerians under the health insurance scheme. Not all sectors are currently covered in the informal sector, and not all the governments are paying the contribution that they're supposed to be. You have the private health insurance, and then, of course, the national health insurance for the public sector. It's not as well covered as we would like it to be, and but slowly it's catching up. So those are the issues: funding, its availability, access. Then you have distance that the patients have to cover, and that's also an issue.
Yeah, and I think when people talk about access of treatment, I always think of that access is more than just financial.
Oh, yes.
So many
hard
other
to reach
things,
areas.
hard to reach
There are
areas,
places in Kebbi that you only get to by boat. So even to give the children immunization, you go on a motorcycle and then you go on a boat and then you
Can I just
complete.
I just have to commend those health workers.
Yes,
that are the foot soldiers that go to all these inner places to make sure they deliver health care. We just have to commend them, because honestly, even when I think of it, I'm like, a motorcycle or a boat. You know what I mean? To get to, like, I just have to say, I want to commend them wherever they are, honestly. And I think the government should celebrate them once in a while.
They do, we do. Both hats of me answering now. They do, we do. and but it's difficult sometimes to actually understand and see what is happening. People talk about technology as a way to overcome all these
Yes,
issues. Drones, for instance, you
yes.
can use drones to deliver to hard to reach areas. How many people have you educated and grown in that hard to reach community that are going to be able to use the medications that you're delivering by drones?
It's true.
So, if you
So
look
there's a
at
lot of
all
work
those
to be
things,
done.
it has to go hand in hand whilst you're developing human capacity and you're bringing in the new technologies.
Technology.
There's some states that are using drones now.
And I think that's a very important point. Like you said, technology is advancing, AI is coming in.
Yes.
But it's very important that you also develop the human capacity that is there. We have to go in tandem. I think that's very important. Now, one of the things I was talking about one thing I don't see so much happening here. We have health advocates. We have people like you going out doing advocacy, doing a lot of good work in this area. But I feel like other women, and we have to also be inspired to also generally advocate. We don't need to be in the health space, is what I'm trying to say.
Absolutely.
Because I noticed that it's left for the health space. Or you are the one in the health. Okay. We will always be listeners. And I just want you to talk to the women. I always say that when it comes to standard in hospital care, that in most places in the Western world, it's actually the community that develops the hospital sometimes. Yes, here everybody talks about government, and government has a role, but in the community, we also have a role to contribute to the system to make it better. So what ways can we inspire that advocacy in women generally? Because women's health suffers globally.
And it's the least
in the
funded
back burner
part
globally. How can we get us to rise up and stand our pace and fight for better women's health, better cancer prevention, better funding to women's health, better research to women's health? How do you think we can inspire our women?
Well, I think this is one of the things that we're doing here. This HERcast podcast is one of the principles behind it is to empower women, to share knowledge, and to build that network. That word network is very important. It doesn't mean a network of women working in the banking sector and living in a city and going for lunch and brunch. It could be a group of women in the village around a well that go. My husband always tells this very interesting story about a village, a community that I can't remember, maybe when he was in the bank, they worked with and they provided water source. They found that the community had a lot of waterborne diseases. And so the bank or some institution built taps for them. Prior to this, the women used to go to the pond every day to fetch water, to cook, to do all their chores. They would go wash and then come back with the water. And so a tap was provided for them with pipe-on water in the city center. And they found that a lot of issues were cropping up and the women were not so happy and it was just not working still. So one of them had the courage to come out and say that walk and that bonding that they do every day is when they hear about whose daughter gave birth, which marriage has broken up, who needs food in her house, and they come together as a community. So it's about how do we balance the two. You cannot just come and say, don't go to the river anymore. Don't do that. It's wrong. You must find a way of providing that networking opportunity for them. They can still go to the river, just don't fetch the water, but do your thing and have your meeting. So one of the very good programs that I really, really liked in Nigeria, when I was in Kebbi, was called Breakthrough Action. It was a USAID funded program, and it spoke to behavioral change and health-seeking attitudes. And it worked at the grassroots. They would have really local town hall meetings. When I say town hall, there's no hall. Sometimes it's under a tree. And come together with these women and educate them about various health issues, what they should do, cooperatives, savings. There's nothing women like in the rural areas like savings, this monthly contribution thing. And then at the end of it, when it's your turn to pack, you have a little extra on top. So they taught them how to do it in a more organized way, opening accounts and so on. Excellent program. Has it been continued? Not so much.
And that's what we talk about sustainability.
Yes, that's why I mentioned it.
And I think but that's very interesting.
Very interesting.
The power of networking.
Networking.
And
so
I think
that's the answer.
I think that's the answer. How do we get networking
more? So
on
us
different levels?
That are on different levels.
Yes.
You can support the other levels, the younger ones in your own cadre and in the other lower earners, and help them to educate them and help them to achieve what would be a bit better in that circumstance. We're talking about drones now. We won't just take a drone and give it to your health worker in Kuje village or something, but you will use what is appropriate for him in that environment. So we can empower them and let them know that that together voice is so much more stronger.
Definitely. Before we close, there is something that I think we should talk about, very important, in prevention of cervical cancer. And I think I always say that I wish this came out when I was of age. And now it's here. And I want to talk about the HPV vaccine. I think, to me, one of the most important vaccines that has been used in the Western world for such a long time, proven, tested, safe, and most times even mandatory in terms of school and things like that. I want to talk about HPV vaccine. And if those who remembered the beginning of this conversation, part 2, we talked about how you get cervical cancer and how the human papilloma virus is the cause of cervical cancer. And the vaccine is to stop the human papilloma virus from causing cervical cancer. So I want to talk about that because I know there's been a lot of talk about that in Nigeria, and it's very important that we educate and clear so women here, mothers, sisters, daughters, whatever, understand that it's an important vaccine to get.
Yeah, so Nigeria has a high population, 200 million, and a little bit over half are women. The age that we're targeting is 9 to 14 of the female population to get that vaccine. We're targeting that age because, like any other vaccine, you give it pre-exposure. So we're targeting that age because that is the age that you assume most girls at that age have not been exposed to sexual activity. We give BCG to babies. We give tetanus, DPT, hepatitis to babies under the age of 1 year, not for any other reason, but because they have not been exposed and they don't have those antibodies. So we're trying to give it to them to stimulate their own soldiers within their body so that when they face that enemy, which in this case is the HPV vaccine, they have the soldiers that are going to fight and ward it off. So there's no conspiracy theory there. And we are supposed to give it to both boys and girls. The only reason we're not carrying out by gender vaccination is the affordability. We have a high population and we were able to reach 12 million. There's still another millions and millions to go that we haven't reached. So it sounds high because we're many. But if we really go to the length that we're supposed to, then we know that there's still a lot of work to be done. And then we now count in the boys. So there is no conspiracy. The issue is that education has not been given. Cervical cancer is real. Women, Dr. Chito talked about, she sees a polyp on she sees a lesion on the cervix when she does a pap smear and she sees something. That's when she exposes the woman's cervix. She puts her on her couch and she looks at it with a lamp and her speculum and she sees it. I see huge abdomens like this. I don't do the pap smears. I see a woman with a huge abdomen. She's hardly able to walk. She's dripping some offensive fluid down her legs and walking through the village or the city or anywhere like that. So it is a totally debilitating disease that we can cancel. If a member of your family has had it, then you will not even question the need to give HPV vaccine. There is no, I have said this like 10 times. I'm a grandmother. I have a daughter who had HPV vaccine and has had a baby, because that's the bottom line, isn't it? We're trying to sterilize the girls. Why on earth would anybody sterilize the girls?
When I heard that, I was like, how does
we
this
want
connect?
children. We want to have daughters.
We want to have children and we don't want cervical cancer.
No, exactly.
Exactly.
We want both.
Yes.
And it's achievable.
It's very achievable. And I think this is something I think the Ministry of Health did recently with their push on trying to do the HPV vaccine.
Yes.
Like you did. I mean, I will just add to women though that you can still get, I mean, this is geared towards accessibility, but if you can afford it, you can still get your vaccines, I believe, up to the age of 26 for one type. And this is a whole conversation I guess we'll have sometime in the future. But up to 26 for the first type, right? The Cervix. And then now we have Gardasil 9, which you can get up to the age of 45.
45,
now,
exactly.
But what she said is very important. The younger population that gets it has, I guess, more active. And I hear they're doing only one shot now.
Yes, so those are the game changers in cervical cancer. Availability of vaccine. What WHO SAGE committee recommending one shot is equally, because we've had it for long enough to look at the data and see that it offers protection and it keeps growing. It keeps growing as we go through the years. And the screening has been around in various ways. And the self-testing. The self-testing kit eliminates the need to go to a health center. It can be transported. It can be picked up. And then it's also less invasive. It's within you, self-care. It's like the self-breast examination. We're not asking women to come and let a man do the test for them, because not everywhere has a female health worker.
Okay, so the younger population, we're able to do a one shot and still see the effectiveness that we need to see. And this is very important for developing countries as well. So do talk to your doctor about the HPV vaccine and accessibility to that vaccine. Forget the stories, because they're stories. They've been used for a long time around the world. And we in the developing world need to catch up to make ourselves healthy. And you have a vaccine that can prevent cancer. You ask me how you can prevent cancer, get the vaccine. And I think that's very important for us here, and a very strong, hopefully, message that you take and advocate around. We educate you to educate 20 more people. If each of you can educate 20 more people, we're going to make a huge impact from this discussion. All right. So thank you so much for joining us on this very important episode of HERcast with Dr. Chito. If you have any questions concerning anything we discussed here, please, you can send questions to us at HERcast Podcast or at Dr. Chito N. And you can also send messages for Dr. Bagudu at Medicaid Cancer Foundation. So we don't miss you and can answer those questions for you. If you missed also any part of our discussion, you can catch the full episode on our YouTube channel, HERcast with Dr. Chito. Now, for the latest updates also, you can follow us on our Instagram page that I just mentioned. And don't forget to tune in to Rapid TV channel 176 Startimes every Saturday at 7 and Sunday at 2 p.m. So thank you for tuning into this podcast, HERcast with Dr. Chito, which is a podcast and TV show dedicated to lending women a voice, empowering them with knowledge, and creating a support network that encourages boldness and the pursuit of dreams. Guys, HERcast is more than a show. It's a movement rooted in the belief that gender equity will transform the world. Thank you for being part of this conversation. Stay tuned, stay informed, stay healthy, and I'll see you next week for more inspiring content on HERcast.